They criticize very severely of saying that we are dangerous and unscientific, which is completely false. There's a lot of expertise on this committee. The fact is that we are honest vaccine scientists that let the data speak, whether the results go in one direction or the other.
That was Dr. Martin Kulldorff, the chair of the CDC's vaccine panel. It has been a very busy week for the group and ultimately led to some big changes to the vaccine schedule and the MMRV vaccine. That's measles, mumps, rubella, and chickenpox.
Lindsay Buckingham spoke with a local health leader on his thoughts and breaks down the new recommendations for us.
The Advisory Committee on Immunization Practices, or ACIP, met Thursday and Friday to make recommendations about childhood vaccines. They voted 8-3 Thursday against recommending the combined MMRV vaccine. That's measles, mumps, rubella, and varicella for children under the age of 4 due to concerns about febrile seizures. Current CDC guidelines recommend children get those vaccines twice, once at 12 to 15 months and again at 4 to 6 years. Parents can choose to get these as separate shots or request the combined MMRV vaccine. But Thursday's committee vote would eliminate that combined option for children under 4. Dr. David Margolius, public health director for the city of Cleveland, says he's never seen cases of these diseases in his 15 years of practice.
They're basically taking away choices from parents and pediatricians that existed before, potentially, if insurance companies were to follow suit, which so far they said they're not going to.
Dr. Margolius says vaccines go through extensive safety research with thousands of people participating in studies before final approval. But he does worry that policy changes could lead to the return of diseases that have been virtually eliminated.
The risk of what's happening here is all of these infectious diseases that we have practically eliminated are going to come roaring back into our communities. That will cause more hospitalizations, that will cause more suffering.
Dr. Margolius points to the hepatitis B vaccine as an example of vaccine success, reducing cases from 90,000 per year to just 20 after birth vaccination. Meanwhile, insurance companies say they will continue covering vaccines that were approved through September 1st, regardless of the new recommendations.
Well, the committee also considered changing hepatitis B vaccine timing from birth to at least 1 month old, but voted 11-1 to postpone that decision. Today, ACIP voted to recommend COVID vaccines for adults 65 and older, while younger people would need to talk about risks and benefits with a doctor first. Christy?
All right, good to know. Lindsay, thank you.
You bet.